My name is James O'Hara. I'm a nurse practitioner with Gillett Health, and this is the Intelligent Microneedling Pen. It's a treatment that you can do at home for hair thinning, hair loss. You can use it to increase absorption of skincare topicals you might be putting on. Probably not vitamin C because that's going to sting, but if you use something like hyaluronic acid, you can get better penetration of that through the skin. So I'm going to show you how it works. It's got a nice little kit that it comes in. Got your instructions. You can store it in this thing. It's a hard shell plastic container. And it comes with your cartridges that you'll use. 16 needles in each cartridge. A charging station. And then the pen itself. And you may or may not be able to tell this by the video, but this is actually fairly heavy. It's made out of metal, unlike some of the cheaper plastic models you might get. And like I said, I've used this. So if you're looking at your settings here, it allows you to set your depth anywhere from less than 1/4 millimeter all the way up to 2.5. I think I said millimeter, it should be centimeter. But you basically dial up what you want to use. You can open up one of these cartridges here. And it just twists in like so. Doesn't click into place, but you can't turn it any farther. Some of you that are stronger than me might be able to turn it farther, but I don't recommend it. And then it's got a protector here, so you're not going to accidentally poke yourself with the needles. You just remove that when you're ready to use it. So now I'm going to just demonstrate the technique here. So turn it on, and you have multiple speed settings. You can go 1, 2, 3, 4, 5, all the way up to 6, I believe. I usually just leave it on 1, not really a need to go faster. You may get more needle sticks at 6 than 1, but this will allow you to make sure you don't over-treat an area. And just kind of show you how I would do this on the temple. And this is actually not going to poke me because I don't have the depth adjusted, but just sort of go perpendicular to the skin, kind of in a back and forth motion along the hairline there. And then you can treat the whole scalp, you can treat just your target areas. As far as what you do afterwards or before, some people will apply exosomes before they microneedle and sort of microneedle those into the skin as extra growth factors. This is done with PRP in clinics and even more powerful microneedling pens sometimes. But home use is probably the most realistic for most people. Most people aren't going to go into a clinic every single week to have their microneedling done, so this is a great option either between treatments, or if you're doing even only home microneedling, this can be a great choice. As far as the depth, that's a common question people have. What depth do I use? I usually have people start with either probably about 1/2 centimeter, just kind of see how that feels. There's different pain tolerances, different scalp thicknesses. The depth is not as important as the outcome you're treating to. So what you want to look for is, you want to look for redness and some pinpoint bleeding. So if I was actually using this and putting it on, whether it's my forehead, whether it's my scalp, whether it's my hairline, what you're looking for is these little pinpoint bleeding. So this is not blood running down your forehead bleeding. This is like, if you really squint, you might see a little red dot there. And you'll have redness even at some of the lower depths. So even if you need to treat with a 1.0 to get the pinpoint bleeding, you may get redness at 0.5. Another common question people ask is, what is the frequency? And it can be quite frequent or quite infrequent depending on how quickly your scalp heals. So if you are going with once a week, which is what most of the studies have done, and your scalp still feels a little bit tender when you're going back to do the treatment, maybe you space it out to every 10 days, or even once every 2 weeks. That's still going to be effective. You're still creating a simulated wound, and the body's going to send growth factors there to try and repair that. And as a side effect, you'll have faster hair growth. And it does augment the results of things like minoxidil that you might also use over the counter. So again, it's something you don't need a prescription for, don't need to see a doctor for. You can still get some systemic absorption of that, and it can cause dizziness in some uncommon cases, so be careful of that. And you also don't want to use minoxidil for at least 24 hours after microneedling. Otherwise, you will get a much higher amount of systemic absorption and even more likely to get some dizziness, palpitations, so different side effects. So you can do this once a week. Apply your minoxidil 6 days a week. Just make sure you wait 24 hours after treatment. Realistically, you should change this cartridge after every use. There are people who will just sterilize it with like isopropyl alcohol, something like that. But really it should be changed every time, just so you are decreasing your risk of a skin infection if you use the same cartridge over and over again. Infection could be a risk, but you're also going to have less sharp needles. They're going to be less effective. So my by-the-book recommendation is to change it every time. That's what I should tell you as a medical professional. If you have any cosmetic treatments, let's say you had your hair dyed, hair colored, something like that, you should probably wait about 72 hours before and after to microneedle, because there are chemicals in those things you don't necessarily want systemic absorption of. Like we talked about, basically most things that go on the scalp or the skin are going to get some level of absorption, it's like sunscreen, but you don't want to try to maximize that. So if you are having your hair colored or dyed, just plan for a few days on either side of that before you microneedle. With this, you can treat just your target areas if you want to be preventive and just hit your hairline. Even if you don't notice some thinning and you're trying to do something that is not involving a medication or something you have to apply, you can just microneedle by itself, and that will stimulate hair growth. If you are someone who is experiencing some diffuse thinning, you can treat the whole scalp, basically all the way from the very back here all the way to the front. The sides, most guys don't have thinning there, but in theory, you could get thicker hair by microneedling the sides, so that's an option as well. Most people will just treat the entirety of the scalp if they have some significant thinning, but I do have some patients who use this and just treat the hairline.